Hello guys and welcome to my channel. My name is Dr. Aisha Akhtar and I am a GP working in central London. I've decided to start this channel to give you guys at home facts because there's so much misinformation all across social media, and I wanted a bite-sized information bullets to come through to you guys about common topics like diabetes. So the first topic I'm going to discuss for today's video is diabetes, and particularly in the South Asian population. Why are our rates of diabetes so high? So everything you need to know about diabetes 101. So today I'm going to be talking about type 2 diabetes, okay? Because that's the diabetes that we can work hard to get rid of and actually stop you from getting in the first place by simple changes in your everyday lifestyle and changes to your diet. So we'll talk about first and foremost how you get diabetes type 2 and ways in which we can stop you or prevent from this happening in the first. So diabetes type 2 is all about insulin resistance. So we have in our body an organ called the pancreas, which has a lot of different hormones, but primarily there are hormones called insulin that the pancreas releases. So over time, if you continue to eat foods which have high sugar or glucose content, the pancreas becomes more resistant to the sugar and therefore secretes less insulin. And that's where we get insulin resistance. So how do we stop that? One, we need to change our diet. So particularly in South Asian populations, type 2 diabetes is rife. So we have, I think, the highest proportion of type 2 diabetes in the world is in Pakistan. And it's because of the foods that they eat primarily. So in order to tackle diabetes, we need to tackle diet. It can be difficult, but there's simple steps that we need to follow to help improve our diet. Now, this doesn't just to people who have diabetes. Actually, these health tips can be followed to everyone because actually it helps make you have a better and healthier lifestyle. However, I think the 3 easy steps. One is to up your protein intake. So you should be having 1 gram of protein for each pound that you weigh, and that's the easiest way to know how much protein you should be consuming. The second thing is to reduce carbohydrates. So no one is saying that you need to completely cut the carbs. You can enjoy bread, pasta. What you want to look at is eating complex carbohydrates. And the third thing is, which is a big no-no, is to avoid liquid calories. So that's your fruit juices, your fruit drinks, alcoholic beverages within reason. You want to mainly stick to tea, coffee and water. So often people don't know that they have type 2 diabetes. It can come on quite insidiously, and by that I mean people don't know until they've had the blood test, which shows their sugar levels have been high. Often, sometimes people can feel excessively tired or thirsty, and they may go to the GP and we will order some routine blood tests which will check your sugar level. Ultimately, a lot of patients have no symptoms at all. However, diabetes can cause serious side effects and affect your body. Now, so symptoms of diabetes can involve, for example, the affecting of the back of your eyes, so it can cause deterioration in your actual vision. It can have a knock-on effect on the kidneys and cause a decrease in your kidney function, how well your kidneys are filtering out the toxins. It can also cause problems in your nerves. It's a term we call peripheral neuropathy, where the nerves get damaged and then they are impaired. So you can often see that people with diabetes have a lot of foot complications. So when they're walking and they step on something, they can't feel what they've stepped on, and then that causes things like you can get diabetic ulcers, okay? You can have diabetic toes, it can cause gangrene. So the list of things that diabetes can do is vast. You know, we learn about the micro and macro complications of diabetes. And a lot of people tend not to consider diabetes as being a major illness, especially in the South Asian communities. They think it's a disease of just having high sugar. What they don't realize is that actually uncontrolled diabetes can have a worse prognosis than someone who has HIV that is taking medication. So that's how bad actually people who don't actually care about their sugar levels and don't, work at trying to keep them down or in control can actually die before those who have got well-controlled HIV. And now when someone tells you you've got HIV, you sit up and you learn and you take note and you do anything to make sure that that virus is controlled. Unfortunately, people don't do that with diabetes. And that's something that I want to change. I want to provide the education so that people really can make a difference. So how do we stop ourselves from getting diabetes? So I mentioned diet. So we kind of break it down into two methods. Conservative methods are things that we can do for ourselves to improve our health. So diet, one thing, it's very important, and 80% of weight loss is through diet alone. So if you are heavier and diabetes is caused because of excessive weight gain, then diet is something that you're going to have to focus on quite considerably. Second thing is exercise. Now I know a lot of people have issues with exercising because of knee pain. Simple walking, 10,000 steps a day, actually does help significantly. So if you can manage, we often say at least 3 times a week, 30 minutes of intense exercise, so much so that you are out of breath when you're exercising. You will not be able to hold a conversation. That's also very, very beneficial. And then non-conservative measures, which means kind of treating with medication. So that would be things like metformin, which is often the first medication we start for people who have got diabetes. Metformin is relatively safe, has been around for a long time. Benefits of it is that it doesn't cause a drop in your insulin level. The side effects are quite mild and people tend to tolerate it quite well. I won't go into all the different types of medication on this particular vlog today. However, if people like this vlog and are interested in learning more about diabetes, particularly the medications involved, then I'm happy to do another vlog talking about the different medications, which include things like metformin, like I mentioned, obviously insulin, which you take after you have had problems managing your blood sugars with the other medication. There are things like sitagliptin, so a whole host of different medications that we use to manage and control diabetes. Of course, everyone knows about the new Ozempic, which is taking the world by storm. Again, I'm going to make another video about the risks and the benefits of Ozempic. So if you're interested, please do leave some comments down below and feel free to message me personally, and I will endeavour to get back to you guys. The other thing which is ever so important when controlling not just diabetes but other health conditions is to avoid things like smoking. So if you are a smoker, please don't despair. But the thing that you can do if you can't quit completely is to try to reduce down as much as you can. Again, with alcohol, you want to stick to the recommended units, which we recommend as 14 units. The less, the better. And then the other thing we would want to mention is things like cholesterol and high blood pressure. They need to be well controlled. So when we diagnose diabetes, we'd often do other routine blood tests, which include your cholesterol level, your thyroid function levels, a full blood count, a kidney function test, as well as a liver function test. So if you're worried about you having diabetes, then please do go and see your GP. It's important to consult your local GP to get those blood tests done and for any further advice. So if you've enjoyed this video and you found some of the information useful, then don't forget to please like, share and subscribe. Hit that bell icon below. It'll really help this channel to grow and help to get some education out there about some common medical topics. I'm I'll hopefully see you in the next vlog, guys. Take care.